He's got the same green shirt on that he was wearing when he did number 5. That's true. Eagle-eyed. That's because I'm doing numbers 5 and 6 in quick succession. So welcome to Arm Wrestling with COVID-19 number 6. In exchanges I've had over the past few days with a couple of people about the guidance and the policies and the advice we've been receiving from our government with regard to the new coronavirus, what we should do, what we shouldn't do, how much we should self-isolate, who can go to work and who can't. I've had two very different reactions from them. One said, "You know what, Harry? I go for a run in the morning, and the people I speak with, at a safe distance, I must assume, tell me, oh, you know what? The government's talking bollocks." Conversely, exactly on the opposite end of the spectrum, the other exchange I had, I was told, oh no, the government is doing an excellent job, an exemplary job under the circumstances. They've only been aware of this coronavirus epidemic, now pandemic, for a very short time. So they're doing the best they can, be that the Prime Minister or the Secretary for Health or anybody else. I don't know how to respond to this. I'm not going to say that the government is talking bollocks, but I'm not going to say that the government is being exemplary. Why? I'll tell you why. The government is not talking bollocks because it is doing its best, its level best, in fact, under the circumstances. It's a new government that's just been elected, and it's been trying to mobilize as much as possible the National Health Service, the people of this country, our resources to try and combat this dreadful, tiny, invisible virus. So is it doing what it can do now? Yes. But then again, talking about the exemplary side, it might be doing what it can now, today, but was it doing what it could have done a few days ago? I don't think so. If I look at what's happened in China, in Asia, then in Europe, in Italy, in Spain, and in France, I think we had quite a long period in order to prepare ourselves more thoroughly for this pandemic, for what is in store for us in the United Kingdom across our 4 nations. And in fact, ventilators, we don't have them. PPE, the personal equipment that people on the front line wear. I have been talking to people in the medical teams, in nurses, who are telling me, Harry, we don't have the appropriate masks, we don't have the appropriate gear. All this is almost like we've been caught unprepared. But we knew that this was coming. So why did it take us so long to suddenly open up the coffers and throw money at the National Health Service? And is money really the answer? I mean, if you ground down the National Health Service for many years, throwing money at it is not going to suddenly provide you with the masks, with the ventilators, with the medication you need, with the testing you need to do, because you don't have the critical nurses, you don't have the training, you don't have the personnel, you don't have the people who are willing and able in numbers to help us face this monstrosity across all 4 nations. So testing, everybody tells you that self-isolation is fine, but self-isolation is not the answer. It just basically manages, delays the calamity, the pandemic. What you need to do is testing, so you know who has it and you know who doesn't have it. Then you have a clearer understanding of the numbers, and then you can actually address and treat those who do have the coronavirus in order to stop it from spreading. But how can we treat it when we don't have the resources for treating it. This is the dilemma we're in, and this is why I'm gravitating somewhere between exemplary, no, not exemplary, and bollocks, no, not bollocks. So, in a sense, I think that what the government tried to do at the beginning is to find a compromise between its economic policies and its health needs. And I think that was a skewed, lopsided equation, because it should have been human and health first, economy second. I think much has been done to wake up during those critical few days, but it should have been done earlier. So when ministers are interviewed by journalists and they are spinning, a lot of the time, human beings, we are not stupid. We might not be able to do anything about it, and we listen passively to what's being said on the radio, or we watch it on the telly, or what have you. But we know when a minister is avoiding to answer a question. You tell the minister, when are those ventilators going to be available? And he says, oh, we're going to have lots of ventilators, 10,000 that Dyson is preparing. Yeah, but Dyson is going to prepare it. Dyson is not a ventilator manufacturer. They're going to be tested. By the time in America, they're now using car manufacturers who are producing ventilators. Why? Because they have an enormous lack of ventilators, and the car manufacturers have decided that it's a money-making scheme as well as providing for the needs of the country. So, in a sense, I think we're all in it together. And what I would say is, if we have more transparency and if we have more honesty from those who are leading us, those who are ruling us, those who are guiding us, I think we as human beings, most of us at least, I hope, would be more understanding and would find the median line between the government is talking bollocks and the government is exemplary, both of which I do not necessarily adopt. And by the way, as we're testing, and as we're trying to manufacture ventilators, and as we're trying to provide the masks and the gear for all those frontline personnel, as well as the people driving the buses, the tubes, people in supermarkets, people working in pharmacies, let us also remember that we need to come up with a vaccine, and that there are two medications, antiviral medications, hydroxychloroquine and azithromycin, which are proving to be quite helpful. Yes, they haven't done all the tests, all the papers haven't been published about it, but can we afford a leap of faith? Should we not afford a leap of faith? That is the question. Thank you for listening to my little self-isolating rant, and until the next number 7.